I'm good. How are you?
I'm good too. We're so happy to that you're here, that you agreed to do this. We're so excited actually. So I'm gonna do a quick introduction, and
Okay.
I we're back to the okay. Hello everyone. We are the Future Dentist, and I am your host Ayşe Camdamar. We have a very special guest today, Dr. Rania Habibi. Uh, Dr. Habibi, thank you again and welcome.
Sorry, it's pronounced Rania Habib.
Rania Habib.
Yeah.
Okay. Sorry about that. I want to give you a little information about Dr. Rania. Rania, sorry. Dr. Rania serves as an instructor in the Department of Oral and Maxillofacial Surgery, Pharmacology at Penn Dental Medicine. She obtained her DDS from the University of Minnesota in 2009 and went on to receive her MD from the University of Maryland in 2012. In 2013, Dr. Habib, am I right? Completed her internship in general surgery at the University of Maryland Medical Center and R. Adams Cowley Trauma Center, where she also completed her oral and maxillofacial residency 2 years later. She then worked in a busy private practice at Maryland Oral Surgery Associates from 2015 to 2017. Rediscovering her love for pediatric surgery, Dr. Habib then completed a fellowship in 2018 in a pediatric cleft and craniofacial surgery at the University of Florida, Jacksonville. Prior to joining Penn Dental Medicine, she served as the first female assistant professor in the Department of Oral and Maxillofacial Surgery at Louisiana State University. She performs full-scope oral and maxillofacial surgery and passionate about pediatric surgery with a focus on providing multidisciplinary cleft and craniofacial care. It is very fascinating. So if it's okay, I want to dive into questions because I'm
of course
curious about it. First of all, other than your CV that I just read, can you tell us a little bit about yourself?
Sure. So my family is originally from Egypt. My parents and older brother and sister were born in a small town called Tanta, north of Cairo on the way to Alexandria. And they immigrated to the States in the late 70s. So my younger sister and I were born in Texas, and then we were raised in Minnesota. And that's where I discovered my love of wanting to be a surgeon. So I always was the first one to grab the first aid kit and want to help bandage up my sister or friends when they were hurt. So that's really where I discovered my love of surgery. I was an American Heart Association scholar at University of Minnesota. So I was originally wanting to do pediatric heart surgery. And then I discovered the field of dentistry, and I was really intrigued by the artistry and the engineering and the patient care that was all involved. So I actually switched paths and went into dentistry. And then while I was there, that's where I discovered my love of oral and maxillofacial surgery and being an actual surgeon, beyond just the dental work that we do. So I completed my residency, as you already said, and then I went on to do my subspecialty in pediatrics because I love treating children, and that's where I am today. So I just started at University of Pennsylvania right in the middle of the pandemic, so it's been quite difficult, but I love what I do, so I'm very excited to be here. So thank you for having me.
Yes, that was amazing. I'm really honored that we have you are our first guest in this project, and I'm really honored that you are our first guest because you are a very inspiring surgeon. So, in becoming a surgeon, that I was gonna ask, why did you choose becoming a surgeon? But you already said that. So this is amazing. I'm sorry, I'm a little bit excited.
That's okay.
So. You said that you started this work, your current work, in the middle of the pandemic. What is different than a normal life and a pandemic life as a surgeon?
So it's very different. It obviously stopped my ability to get my privileges at the hospital. So When you move to a new state in the United States, you have to get a new state license, both in medicine and dentistry, and then each hospital has to certify you to be able to work. So obviously with everything shut down, it was impossible to get all of that. So I was working on what we call like emergency pandemic privileges. So I was only able to really see emergencies. So facial trauma and infections, things that would like threaten people's lives. But until this day, I still haven't been able to see any elective surgery. So from a surgeon's perspective, it's obviously very, takes a lot away from my practice and my ability to build my practice. But now that I finally have all of that underway, it'll take a few more months. So it slowed down my ability to actually fully integrate into University of Pennsylvania. But we're almost there, probably another month or two. But I think it's just the anticipation. So we stopped all elective surgery in the US. So we weren't performing any type of surgery, so that all the focus was really on patients who had COVID-19. We could free up space in the ICU. We were using surgical rooms as ICU beds. And then we were on standby to potentially go to other departments as backup if they needed us. So ultimately, Pennsylvania did a good job, so we didn't have a surge in patients that needed us to cross over and work in a different field. So we're kind of revamping surgery very slowly. So I think right now we're only up to like 75% of our normal volume. And then for me, I haven't been doing a lot of surgery. I've been teaching mostly at the dental school. So that's a new role for me where we normally do that, like 1 day a week or so, but I've now been there 4 days a week. So I teach there Tuesday through Friday. And it's been extremely rewarding, but as a surgeon wanting to be in the operating room and actually doing surgery, it's been quite difficult.
I can't work, but I hope I will one day. Okay. What is the public perspective on dentistry in America?
I think it's one that's a little neglected in terms of people don't consider oral health as important as their systemic health. So it's been difficult to help change that mindset in the US, to help them understand that like your oral health is just as important as your systemic health, and they're linked and they're not two separate entities. So I think the American Dental Association has done a good job of promoting oral health and explaining to the public why they should not neglect their oral health. But I still think when you compare it to medicine, the public is always, they look at their oral health as the secondary measure. It's not the most important thing. So I think, unfortunately, that's not just in the US, that's pretty worldwide, that's a consistent theme. So I think with social media and with different outlets, we're able to lend our voices as professionals in the dental field to kind of say, hey, like you should pay attention to this, and this is the reason why. And so it's been a good outlet to educate the public on oral health.
Yeah, exactly. I agree with you. I would like to ask a question that advantages and disadvantages being a surgeon in America.
So some of the advantages is, you have to love what you do because it's a very busy field. So when you think about the sacrifice that you're going to make, it has to be something that you're willing to make. So you have long hours, you have unpredictable hours when you're on call. The lifestyle can be difficult for people who aren't used to that, lack of sleep. There'll be nights when I don't sleep very much and I'm on call. The training is very, very long. So any surgical specialty in the US is going to take you, probably a minimum of, when you think of undergraduate, graduate degree, and then your residency, likely somewhere 12 years or more. So you have to be willing to put in that time. So I think the disadvantages are the time that it takes away from your family and friends. So if you're on call, you can't just say no, you have to go into the hospital when they need you. So that could be difficult. Some people have found it difficult to balance family life and personal life with a busy surgical schedule. I do a pretty decent job of being able to see my family and friends and work out and cook dinner. So I make it a point to really try to make that balance as much as I can. I think those are some of the major advantages and disadvantages. And then, you know, for me, the biggest advantage is just being able to provide a surgical service to someone who otherwise doesn't need it. So in my realm, that's restoring their facial structure, it's restoring their ability to eat, reconstructing the face, reconstructing defects. And so there's nothing, in my opinion, more rewarding than that ability to restore and reconstruct someone's identity, which is their face.
Yeah, it's perfect. Going to the next question. You're a great surgeon and great teacher, I'm guessing. So if you wouldn't become a surgeon, what would you want to do?
Yeah, that's a fun question. So I think I probably would have gone into journalism. So I really like connecting with people. I love telling people stories. So I think I would have been like a field journalist where I could go to, you know, areas of conflict or areas where people needed their voices heard and told their stories via journalism. So I was always fascinated by, I was the little kid who used to watch Oprah as a kid and see what she did, and you know, all of the CNN specials, and they would go into the war zone and talk to people, and I was really fascinated by that. But there's just something beautiful about connecting people, and so I love public speaking. I love bringing people together. So I think I would have been a field journalist.
I think you're already doing it by telling minority stories in your Instagram. You have a great project that's called Minorities in Medicine, and you're doing interviews with doctors who don't have privilege, I mean, like the other doctors. What is the most important inference you have ever made based on both your experience and what you heard from them?
So Minority Voices Medicine was a project that I started just based on the disparity in care that I was seeing within medicine itself. There are so many minorities that are not represented in medicine. You know, every field is still majority white, Caucasian males. And so even when you look at females, that's considered a minority. If you look at different religions, whether there's Judaism, Islam, if you look at, you know, Buddhist and all these different representations, Native Americans in the US, all the different racial groups, they're very underrepresented. And so with the Black Lives Matter movement that has happened, started in the US but has traveled all over the world, to me, I really felt like, let's tell people's stories in medicine and showcase to aspiring dental students or medical students or even like teenagers that they too can be a medical professional because they see someone like them in that role. So that's why I started that project. So I think the biggest difference has been students who have reached out to me and said, wow, like you showcase this you know, Black female dentist, and that lets me know that I can do it too. And she's an entrepreneur, so she started her own hair care company while being a dentist. So it's just being able to show the students that like, hey, you can do this, and it's in your dream. So giving them a role model to look up to. And so it's a very new project. I've only had 3 episodes. I do it every other Sunday because I alternate with my oral surgery IG Live, and it's been good so far. So I would say that's the biggest difference, is just giving students a chance to see someone like them in a role that they're not used to seeing.
Yeah, exactly. By the way, go check it out. It's a great project, and that's true. We need role models. As a female dentist student, I am looking up for you because you inspire me in many ways. You're a successful surgeon. You made your voice to be heard, and it's amazing. So thank you for doing this.
Of course, thank you.
So do you think social media is an effective way to raise people awareness and educate them?
I do. So I was very hesitant to join social media. I only joined about 2 years ago. And that was because I didn't know the power of social media at the time. I was like, oh, this is something people just waste their time. It's not worth it. But what I have found is, you know, when you look at my specialty, oral and maxillofacial surgery, if you just stop some random person on the street anywhere in the world and just say, what does an oral maxillofacial surgeon do? A lot of them can't answer that question. And I found that was very true even in dentistry and even in medicine. Nobody knew the full scope of services that we were able to offer. And I think by showcasing, so for those of you who haven't seen my account, it's very focused on just surgeon life. So I don't bring a lot of my personal life into it because I'd like to keep that private. But I will highlight my struggles in surgery, my struggles in my studies, my struggles as a female minority in medicine, in surgery. I show people how I balance my life. So I'll show how I work out and how I'm able to meal prep and make dinner. And I will show some instances of spending time with family and friends. And then I talk about, I'll highlight some of my, students and residents and what their accomplishments have been. So I found it's an excellent tool to connect with other professionals. And so I found lots of dentists and medical doctors who really didn't fully understand what oral surgeons actually do. And so they've reached out to me and say, wow, this is amazing. And they're starting to give a voice to our specialty, and it's really helping it become like a normal topic of conversation. So my goal with my social media is that if somebody does have an accident in their face and they're showing up at the emergency room, they're not just asking for an ENT or a plastic surgeon. They're going to say, hey, I would love to see an oral and maxillofacial surgeon or a plastic surgeon or an ENT. So they fully understand that we're able to provide those services just as well as our medical professionals. And depending on the training area and stuff like that, sometimes we have the more in-depth training for that too. So my goal is to educate the public, but also educate our medical professionals so that they know the full scope of what we can do. And I've really seen the power of that through feedback, through being included in different projects where other specialties say, hey, like we want an oral surgeon to be represented. So that's really meant a lot to me. And I've had a lot of my own professional colleagues reach out to me and say, wow, like what you're doing for the specialty means a lot. Like people know who we are and what we do because you're sharing your story. So that really has shown me the power of good of social media. And obviously there's bad sides that come along with that too. You're under the microscope and people, make, oh, Dr. Habib, are you going to put this on social media? And I'm like, yeah, I am. So I think those are all important factors. So I'm always very careful with what I post, but I try to be very deliberate with what I post. So it's motivational and it encourages people to understand more about what we do.
Yeah. Okay. I really don't want to ask this, but I will. As a successful female surgeon, what was the biggest challenge for you to deal with, and how did you overcome that?
So for those who don't know, oral surgeons, there's only 8% of oral surgeons are females in the US. I don't know the worldwide numbers, but some countries are even smaller. So we are a minority. And I think the hardest challenge was just getting into the specialty. So when I was applying, which was back in 2009, there were several programs that had never taken a female resident in their history. So they didn't even look at females as like an actual candidate. So that was really difficult to understand because, my parents had always taught me you can do whatever you want, you can accomplish whatever you want. And I never thought that my gender would be something that would be looked upon in a negative way. And so that was very eye-opening, that I was like, what do you mean these programs won't take a female? So times are changing very well. There are still a few handful of programs that have never had a female resident to this day, or haven't had a female attending, or have never had a female leadership role. So I'm only the second female in the history of Penn. I was the first one at LSU. And so I think it's overcoming those barriers. So I went to a very female-friendly program, which is at University of Maryland. But even then, there were several of my male colleagues, several male coworkers in other departments that didn't treat me as an equal. They saw me as like a lesser surgeon, or I just didn't know how to handle the pressure. So it was really fighting that stereotype by showing them that I was just as good as them. And even as an attending to this day, sadly, I still run into instances where I feel like I'm having to prove myself. And so it's going to take a culture change within medicine and surgery itself to really make that change. And it starts from within. So it's colleagues, if they're seeing something that isn't correct, standing up for it. It's us as females bringing awareness to the things that need to change. And it's going to take some time, but even in the time that I've been a surgeon, it's dramatically getting better every day. So that was the hardest part. It was literally just getting in.
Still struggling, but I hope we'll get there one day. So what should we look when we decide the department to specialize? So what are your advice for students who want to become a surgeon?
Okay, so I think the most important thing for dental students to really do to decide your specialty is to shadow in all the different specialties that you have an interest in. So keeping an open mind during your beginning studies and learning about all the different specialties. So endodontics, prosthodontics, periodontics, pediatric dentistry, TMJ, disorder, oral pathology, oral and maxillofacial surgery, implantology, dental anesthesiology. So there's all these different specialties. So I think it's a couple of things. One is identifying what speaks the most to you, if any. So if you really like the variety and general dentistry seems like the best fit because you want to do a little bit of everything, then there's no shame in being a general dentist because you really get to do a lot and you're building rapport with your patient. You're the one who always sees the patient over and over. So there's a lot to be said about that. But if a specialty starts to speak to you, I think you need to take the time as a dental student to shadow within that field. So I don't think it's enough to just say, okay, I'm going to go to my one department and spend the day in oral surgery. I think you need to go and spend time in a private practice. I think you need to go to a residency program. I think you need to go to a hospital and really get an understanding of what the entire field actually entails. So if you're thinking about orthodontics, go to the orthodontic department, introduce yourself, start seeing what they do, but then go into the industry and go to an orthodontic office and say, like, what is your day-to-day? And really decide if that specialty fits your personality and your personal goals and also your family expectations. So if you're not someone who wants to be pulled away from your family or you don't want to sacrifice a certain amount of years to study, then you have to make that adjustment. And so once you've decided on your specialty, then it's really putting in the effort to make sure that you're the best candidate. So for competitive specialties, you need to have good grades in dental school. So focusing on getting excellent grades. You want to do volunteer work, and whether that's within your country, your own community, at your dental school, with your church, with your mosque, with your synagogue, with other organizations in the political, whatever it is that, you are interested in. Volunteer work really shows that you can give back to your community, which is important. And then I think it's finding activities that speak to you that you can do. So what we look at in surgery specifically is somebody who can manage multiple things. Like if you just sit in a bubble and study, we know that any dental student who's type A and very smart can get excellent grades by just studying. But we're looking at someone who can manage having a busy life while being a good student. So we want people to do research or work in a lab or, like I said, be part of a volunteer organization and then, still maintain grades while they're doing that, be part of your student council. So that shows that you're well-rounded, that you can handle busy situations, and those are very important skill sets to have as a surgeon. And then you have to look at your specific country, if there's any type of entrance exam for that specialty. So in the US for oral surgery, there's an entrance exam that you have to pass. And then obviously, depending on your country, doing very well on your dental exams, because that is very important. So we have not only the exams for each topic in dental school in the US, but then we have the national exams that every dental student has to take. So again, it's taking the time to study and making sure that you do really well in academics and on all of your exams.
I see. So to becoming a surgeon, you need to be very a multitasking person. Mm-hmm. I'd like to ask what are your priorities in communication with patients? What are you paying attention to?
So for me, my patients always understand why they're there, first of all. So I really take the time to get to know their problems and their expectations. So understanding why they're in my office, what has brought them there, and then what are their expectations. So what do you hope to get out of this appointment? So for the dental pain patients that just need a tooth pulled, it's understanding, you know, what their fears are, what their hesitations are, and then setting very clear expectations. So I have a very thorough discussion with every surgical patient. You know, these are your risks of surgery. These are the benefits of surgery. I take time to answer all of their questions. And then I really set out the expectations so they understand what they're going to undergo. So I describe the surgery in detail, even something as simple as a tooth extraction, all the way to my cleft and craniofacial patients, so they know what to expect. I tell them my role in their care. So this is the surgery that I'm going to perform, and this is what you should expect for the healing phase. And then I make sure they understand their part in surgery, because I can be the perfect surgeon, but if they don't take care of the surgical site, it's never going to heal. So I lay out very high expectations of their own care. So I need you to do A, B, C, D, E. And not only do I verbalize that, but I give them a form that has all of this laid out so that they can read it and they can follow it. And I make sure that they understand if I'm going to operate on them, they have to hold up their end of the bargain, which is their post-operative care. And then, so I'm really big on communication with my patients. So I usually take a little extra time in my appointments compared to some of my partners. But what I found is then I have very little complaints because the patient knows exactly the surgery that they're going to have. They understand what to expect, and then they understand how their role is going to be important in their own care. So whether it's diabetic control, not smoking, applying certain creams, massage to the scar area, they fully understand their role to optimize their outcomes. So I would say communication is the most important.
Do you have red flags for patients?
I do. I think some of the red flags that I have are a patient who's hesitant to see me. So they might make comments about, oh, you look too young to be a surgeon, or do you know what you're doing? And for those patients, I used to take offense and be like, oh, I'm going to prove them wrong. And then I realized it's a mutual contract between you and your patient. So if your patient does not feel comfortable with you as their surgeon, then it's time to say, okay, you know, I don't think this is the greatest fit. Let me introduce you to my colleague and see if that's a better fit for you. Because what I've learned is there are going to be complications in surgery, right? There's no perfect surgeon because you can't control the way the patient heals. You can't control forces of nature. So a patient who already has your trust, that trusts you, even if something bad happens, they trust that you're going to get them through that. But that patient that already didn't want you as their surgeon, if something goes wrong, well then forget it, like you're done. So I no longer try to win those patients over. I just refer them to somebody that might be a better fit. And I don't take any offense. I say, it doesn't seem like you're comfortable with me as your surgeon, and that's perfectly fine. I have so many different partners. Let's find one that is a better fit for you. And I leave it at that. So I think it's very important to be selective when you pick your patients too, and understand that if they're not comfortable with you as their surgeon, it's just time to refer them to somebody that they feel more confident in.
Okay. What do you think is the biggest issue in a clinical environment?
Communication. So when you're in a clinical environment, you're managing, you have your assistants, which are very important to deliver care. You have to have amazing assistants so they can make your life very simple as a surgeon, and they make everything kind of flow. You have your front desk who's scheduling your patients, who are the direct source between you and your patients and making sure that they're scheduled. You have your finance and your billing people that are helping make sure that the income is coming into the practice. So every single level of communication in the office has to be spot on. So it's things like writing good notes so that when my assistant or my front desk opens up my chart, they can read my thoughts and understand what I'm going to deliver for the patients. Communicating with all my specialists. So when a general dentist or an orthodontist or somebody sends a patient to me, I'm calling them up or sending them a letter or an email that says, I saw your patient. Thank you so much for the referral. This is the care that I'm going to provide. Is this what you expected? So that it's closing that loop of communication and making sure that everybody's on the same page so that we can optimize the care for the patient. So I think when people in clinical care don't have good communication skills, and that even is like writing a good note, then it can break down that circle of care for the patient.
So it takes a lot of teamwork.
Teamwork.
So for my final question, I would like to ask, do you have any advice for dental students in general?
I think for dental students, it's really just being a sponge in dental school and absorbing every single thing that you can. So you're going to see every one of your instructors do something a little bit different, put their own little spin on it, and you should open your eyes to that and take notes on it and use that as a tool in your toolbox so that when you start to develop your own way to practice, you can borrow those ideas and those techniques from every single instructor that you met. I think that's extremely important. I think it's also important to not put yourself in a bubble. So even though I realized I wanted to do oral surgery, I still made sure that I knew how to make an amazing set of dentures, that I knew how to, carve a crown, and I knew all the principles of dentistry, because that helps me be a better surgeon. I know what my specialists and my referrals want from my care, but it also helps me understand the fundamentals of my surgery. So when I'm doing a full mouth extraction and alveoloplasty and removing undercuts, I know what they need in the bone to support the denture. So it's not putting yourself in a bubble. If you're all set about oral surgery, then you can't just focus on oral surgery for the rest of dental school. You still need to learn all the other specialties and how they work, because that's going to make you the best dental provider once you enter the field and you do become a specialist. So being a sponge and just absorbing as much as you can and using each experience to contribute to your own care one day when you're a dentist or a specialist yourself.
It was really, really good. I mean, I'm really happy that you're here today. I'm saying once again. So thank you for joining us.
You're welcome. Thank you. Thank you for having me.
You said that you had a slide that you made ready for your info.
Yes, let me see if I can pull it up really quick.
Okay.
The chat for those who are here.
Okay.
So my Instagram is just my name. It's raniahabib.md.dds. And then my email, if you go to my Instagram and just hit email, it'll send the email to my personal email, but I can send that to you as well. But that's the easiest way, is if you just go to my Instagram page and go to my website, you'll see all the different links that will get you in touch with me.
Okay. Thanks so much for sharing your advices and answers with us today. Hope we'll talk to you again in the future, maybe.
Absolutely, and thank you all for attending. It was so nice meeting with all of you, and I hope that you learned something today.
Yeah, we definitely did. Thank you so much.